Hey everybody, my name is Shannon Griffin. I go by Michelle, which is my middle name. Um, it's kind of a family tradition of my family's, and it's fairly common here in North and South Carolina for people to go by their middle names. I have a 3-year-old son named Carter, who I did not torture with that same tradition. I hope he thanks me later when he gets older. Um, I'm married to my wife and best friend Jennifer. We have 2 dogs and 2 cats. One cat you might hear scratching and whining in the background, so I apologize for the background noise. We currently live in Clayton, North Carolina, which is a suburb of Raleigh. Um, I grew up in the mountains of North Carolina in the Asheville area, so if you've ever heard of the Biltmore House, that's the place in North Carolina I grew up. Um, I graduated from NC State back in 1999 with a Bachelor of Science in Zoology with a concentration in pre-med. Once I got out of college and started working, I decided I didn't want to go through all that schooling and do residency, which is kind of ironic now because I am at 40 and I'm going back to school and hoping to make a career change. Um, I've pretty much worked in medicine since I graduated college. I've done phlebotomy, I've done pharmacy tech, I've been a paramedic, and my longest job has been a clinical research coordinator, which is what I'm currently doing. I work at Duke University Medical Center in the emergency department. I like the fast pace of the emergency department and the constant changing of the types of patients that come in. We have several different studies in the ER that I work in with Department of Defense grant, working with traumatically injured patients and patients who are critically sick up on the ICU, stroke studies. We have acute coronary syndrome studies. We have a new phase 2 drugs trial, which is my favorite, in congestive heart failure. I like drug trials because they're sometimes the most rewarding, but they have a lot of moving parts and they're just fun to work on. We also have a ton of poisonous snakes and spiders in North Carolina, so we do snake bite studies. This area especially is a high concentration of copperheads. Copperhead bites bring in about 30 to 40 patients to Duke Emergency Department alone each year. We have one of the leading snake bite specialists on staff, which is a lot of fun. We're all kind of snake bite specialists by default. So I started becoming interested in public health because I was a paramedic for a few years. So you can imagine being a paramedic isn't all lights and sirens. It's not how it is on television. We do go to those serious calls, and it can be a very rewarding and challenging job. It started hurting my back, so I had to stop picking up all the obese patients in the area. But it exposed me to people's homes and just different kind of scenarios that happen out in the world that most people don't ever get to see. When I was leaving being a paramedic, they brought in what was called community paramedicine, which in a way is a marriage of public health and paramedics, because paramedics aren't necessarily on the ambulance. They go out in smaller vehicles to patients' homes. So a lot of people call 911 because they have a cold or they have a toothache. The emergency department can't turn anybody away, and a lot of 911 systems can't turn away patients either. They have to they have to transport if they want to be transported. So you get inundated in the emergency department with colds, toothaches, stub toes, splinters, all sorts of stuff you could never imagine. So community paramedics go out into people's homes and say somebody has a cold and a fever. They educate them on Tylenol. They help them take Tylenol. They educate them to stay home for so many days until symptoms get worse. They check their vital signs to make sure they don't need to go to the hospital. They go help diabetic patients with their insulin. Sometimes a diabetic patient just needs to eat a peanut butter sandwich, so I've made many a peanut butter sandwiches for patients just to help that protein go with the insulin to bring people's blood sugars up. So, reducing bottleneck in the ER is huge. And it's a public health problem. There's psych patients and everything that inundate the ER. That's really where I found my interest in public health. I've been out of being a paramedic for a few years, so in the ER and at Duke, we have a global health program. One of our attendings is a global health professor, so I got the awesome job of getting to go to Moshi, Tanzania, just recently in the last year, to help set up a research program out at Kilimanjaro Christian Medical Center. That really sealed the deal for me for wanting to come back and get my master's of public health. Um, I always wanted to go to Africa. I love Africa. I love the people there. Um, there are so many things that need to be done in third world countries that so many people don't see, and that's something I'm very interested in, is global health. Also with epidemiology, having a paramedic background, and being overseas and seeing a lot of the illnesses, it's really sparked my interest. So for now, that's kind of where I want to go with my master's of public health. Um, I got to hear Dr. Paul Farmer speak. If you haven't heard of him, look him up. You will enjoy his books. He is huge with public health and tuberculosis overseas. He has done a ton of tremendous work in Haiti. That also has sparked my interest in epidemiology. Um, you know, with getting my master's of public health, my ultimate goal is to become a physician assistant. I've heard a bunch of you say that so far, which is really cool. Hopefully we can talk about it. I think that getting your master's in public health can help bring a more holistic approach to patient care, help educate patients better about their diseases and how to reduce their trips to the doctor and to the emergency department. I also really want to do emergency medicine in a foreign country. Something I noticed in Moshi is that there's no ambulance or 911 service. That's something I'm passionate about is pre-hospital care. And I really want to go, and I have so many research ideas. So I think that getting a master's of public health and becoming a physician assistant, I can put those research ideas to better use, especially in the pre-hospital setting, and also in the emergency department setting. So that's about me. I look forward to being in class with all of you guys, and sorry I've talked your ear off. I will put all of my contact information in my post so we can collaborate with each other and even just get to know each other better. And I look forward to class. So thanks a lot. Bye.